So we begin with a discussion on economic survey, chapter 11. Chapter 10, I am deliberately not doing with you because that is on sustainable development. So from economy point of view, that will not be very relevant. Most of those things you cover already in your discussions in the classrooms. So I'm moving into chapter 11, which is an analysis on education and health. So again, if you see, health and education are key drivers for human well-being, and we see that in health, the progress is about improved access to affordable care, reduced infant and maternal mortality, higher immunization, and better primary health care. In education, we have rising literacy and enrollment, expansion of vocational education, and reforms in the Right to Education Act. So overall, health and education are doing better in India than what they used to do in the past. But if you look at persistent challenges, the quality is a big issue, both health and education, especially public sector quality. Regional disparities are huge. Some states are doing very well, some others are doing not so well. Socioeconomic inequalities are tremendous. That's another challenge that we see in health and education. Some class of people are doing very well. Then digital divide is there and infrastructure deficit is there. When we look at school education progress in India, of course, it is crucial for a Viksit Bharat, and demographic advantage, if we see that we have 27% population in 3 to 18 age group, so school is going to play a massive role in future. If we look at this, the percentage share of 3 to 18 year old, you see India and Indonesia are as the two countries which has large enough percentage of population in it. And if you look at Human Development Education Index, India is not doing great here, 0.372. All other countries have a very decent number. Indonesia at 0.575, even China at 0.626. So that means that given the report, we need to do better on policy index and with respect to human development and education. Of course, we need to also make sure that the expected years of schooling rise in India. It's 13 years. Ideally, it should reach 15 years. That's what the economic survey says. कि अगर ये 15 साल हो जाए तो ज़्यादा अच्छा होगा. NEP 2020 का फोकस एरिया भी है कि लर्नर सेंट्रिक और फ्लेक्सिबल मॉडल बनाए और एम्फेसिस हो ऑन फंक्शनल लिटरेसी एंड न्यूमरेसी, ऑन ECCE, रिड्यूसिंग ड्रॉप आउट्स, करिकुलम रिफॉर्म, टीचर्स की कैपेसिटी बढ़ाएं जो बहुत ज़रूरी है. अदरवाइज अ पुअर क्वालिटी टीचर विल मेक इवन अ गुड क्वालिटी स्टूडेंट इनटू अ पुअर क्वालिटी स्टूडेंट. Higher education should be based on multidisciplinary learning, institutional reforms, etc. Also, vocational pathways should be introduced. So, government has introduced Sarv Shiksha Abhiyan, Ullas. Ullas is related to learning and and numerical skill ability, where it is about making every adult in India numerate and literate. PM Shri is about schools for rising India. PM Poshan is for nutrition. Parakh is for checking the quality of education and holistic education in that. And then Vidya Pravesh, Diksha, Nipun Bharat about making sure that you have better quality education with literacy numeracy for all in India. Then when it comes to school infrastructure, one is system scale. There are 24 crore plus students across 14 lakh schools with more than 1 crore teacher, and 69% of schools are government and 50% enrollments are in government school, which should worry us. Ideally, there should be more enrollment in government school. They are free and they have midday meal scheme, but the quality levels suggest that we are struggling there. And private schools are 26% and enrollment is 41%. Rest are non-government schools, public, private, and so on. The enrollment trends show that now we are almost reaching 100% gross enrollment ratio in school, and at foundational level it is 41.4. Preparatory level 95.4, middle level 90.3, secondary level you see the drop. This is something we need to change, that at secondary level our school education is showing a drop at 68.5. तो ये number बढ़ाना ज़रूरी है. Of course there are APAR IDs and 13,000 plus PM Shri schools. अब ये सारे facts अपने पास एक sheet पे लिख के रख लो. इनको तुम यूज कर सकते हो when you talk about level of human development and government policies for human development in India. So take them as facts which you can use over there. Then of course, when we look at early childhood care, Anganwadi centers are the main factor, and with them co-located are multiple schools, almost 33% schools, and Balvatikas are there. Balvatikas are a new beginning in India, where again holistic education is being targeted. Then of course we have preschool facilities available for 52% of government schools. This needs to improve so that we can have early education, but the preschool should not be focused on creating literacy and numeracy. Preschool should be focused on creating acquaintance to school, habit of reaching school on time, etc. Then, of course, we have PM Janman targets where PVTGs with 500 hostels approved. So we are targeting Eklavya model schools over here. Then Kasturba Gandhi Balika Vidyalayas with 2682 residential schools being brought in for upgradation, and Dharti Abha Janjatiya Gram Utkarsh Abhiyan. So again, ये factors याद रखोगे, इन डेटा को याद रखो, इनमें और कुछ याद नहीं करना रिगार्डिंग इंक्लूसिव एजुकेशन. जब इंक्लूसिव ग्रोथ की बात होगी तो इंक्लूसिव एजुकेशन में ये बातें तुम लिख सकते हो. देन टाइम यूज सर्वे रिपोर्ट ये बताता है that participation in learning among children in 6 to 14 years has increased from 86% to 89% in the last 5 years. Female participation has rose to almost 90%, and average learning times is almost touching 7 hours now. These are all good numbers, but again the school education has to be holistic. स्कूल इंफ्रास्ट्रक्चर हैज डन, ये टेबल बहुत इंपॉर्टेंट है, इसको याद रख लोगे. पिछले 5 साल में हमने काफ़ी इंप्रूवमेंट्स कर ली हैं विद रिस्पेक्ट टू ड्रिंकिंग वाटर, गर्ल्स टॉयलेट, बॉयज़ टॉयलेट, हैंड वॉश एंड सो ऑन. देन ऑफ कोर्स वी सी दैट pedagogy has to be innovative and community participation. तो हमने कोशिश किया की है कि जो एक्सेस का गैप है, जैसे सेकेंडरी नेट एनरोलमेंट रेट इज 52.2%. दैट्स प्रीटी लो considering that that secondary enrollment rate should rise with more education and development of India. And the weak retention is there beyond grade 8 because the right to education ends over there. Also, 54% schools offer only foundation and preparatory levels, while 17% rural schools provide secondary education, while 38% in urban areas. So retention of children, quality education, rural school giving secondary education, all that becomes important, and we need to focus on that. Existing efforts are PM Poshan, Samagra Shiksha Abhiyan. PM Poshan is for providing midday meal and preschool nutrition. Samagra Shiksha Abhiyan is for holistic education development. पहले सर्व शिक्षा अभियान था, टोटल लिटरेसी मिशन. अब समग्र शिक्षा अभियान है, होलिस्टिक लिटरेसी मिशन. साथ में अब जो शिफ्ट है वो कहाँ रिक्वायर्ड है? फ्रॉम एनरोलमेंट फोकस, सिर्फ बच्चों को स्कूल तक लाने से काम नहीं चलेगा, लर्निंग आउटकम्स एंड रिटेंशन पे ध्यान देना पड़ेगा. कितना सीख रहे हैं और जो सीख रहे हैं उसे इस्तेमाल कर पा रहे हैं या नहीं. देन ऑफ कोर्स वे फॉरवर्ड इज composite and integrated schools and upgrade schools to class 12. Composite and integrated schools are schools which can give better quality education, holistic systems, sports, culture, art, everything being taught, and upgrade even the rural schools there. Also, open schooling should be strengthened quality wise. हमारे यहाँ open schooling होती है लेकिन qualitatively बहुत compromised है. Also, improve teacher capacity through national tests of diet and SCERTs. And community and parental participation has to be improved. जैसे कुछ एक्सपेरिमेंट्स किए गए हैं कम्युनिटी पार्टिसिपेशन पे, एक बॉक्स बना के सर्वे ने दिया. तो एजुकेशन एक्सटेंड्स बियॉन्ड स्कूल. तो कम्युनिटी स्कूल पार्टनरशिप में कम्युनिटी मोबिलाइजेशन के एग्जाम्पल हैं जैसे चाडुवुला पंडुगा इन आंध्र प्रदेश एंड आलोकार जात्रा इन असम. इससे एनरोलमेंट बढ़ा बिकॉज लोकल एजुकेशन डेटाबेस बनाए गए और टारगेट किया गया कि जो बच्चा स्कूल के बाहर है वो क्यों स्कूल के बाहर है. Our school Chale in Haryana is again using local collaboration to improve enrollment. Then Zilla Parishad School Jalinder Nagar is using peer learning, subject friend model, where teachers are in shortage, so different age group children are brought in together, and these different age group children are studying together. Similarly, coding, robotics, and multilingual education can be brought in, and enrollment has started increasing there. In fact, Zilla Parishad School Jalinder Nagar has been given as one of the as the best school in community training award at the global level. World recognized globally as world's best school, community choice award. Then teachers have a community network role. Peer networks improve motivation, support, and policy. Now we need platforms, recognition systems, etc. So it provides real world exposure, linking academics with local needs. It's very important. It's very important that we train our children not only in academics but holistically in their overall requirement. Now the learning improvements have been there. अगर हम 2001 से कंपेयर करें तो इम्प्रूवमेंट है. तो जो परख 24 है वो बताते हैं that competency based evaluation of learning outcomes and holistic development to inform policy, curriculum and planning. परख को यूज़ किया जा रहा है कि holistic development हो रही है या नहीं, प्लानिंग कैसे करें, पॉलिसी कैसे बनाएं. उसके लिए लर्निंग आउटकम परख ने बताया दैट grade 3 shows post-COVID recovery. Girls are outperforming boys in language and are equal to them in mathematics. Rural students are outperforming urban. Government schools are leading, reflecting Nipun Bharat mission impact. But again, this is all said by survey. But if you look at it in practice, we see that when you make a comparison of good quality government schools, opportunity to good quality private schools, when you make a comparison of opportunity for boys and girls where equal opportunities are there, तो ये numbers सही हैं. But जब आप depth में जाते हैं, ये number अभी भी where the government schools in rural areas are still not functioning well, girls are still not getting the chance to get educated as much as what they would like to. The number of enrollment in government school is still not picking up. So that, if you ask me, is the challenge. Then of course Vidya Samiksha Kendras have been rolled out for data driven monitoring, but इनकी coverage 1 लाख schools भी नहीं है, जबकि अभी हमने पढ़ा that India has much more than that number. Then of course the Parakh has identified other gaps, like only 35% schools accommodate children with special needs and 38% have trained teachers. That's one challenge. Only 55% students feel motivated, less than half feel emotionally safe. तो अब सोचिए इसमें learning कैसे होगी. तो कोशिश क्या करना है? Go into beyond aggregate scores and focus on concepts, focus on social emotional learning and make sure that school entry age is important. ये देखा गया है कि if you are 8 years plus, then the learning ability is more than 1.5 times compared to 8 years minus. So make sure people are in right class at right time. So that is what is very important. TARL है, targeting at right age, or right learning. So targeting age for right learning, TARL by Pratham, is a very important concept. Then we talk about policy imperatives. So this is about what to do in school education. So deepen education quality, reduce regulatory frictions. बहुत ज़्यादा restrictions मत लगाइए, school खोलना आसान कीजिए और quality अच्छी कीजिए. Measurement or accountability through participatory education models. Let everybody collaborate and develop their quality. Achieve demographic dividend, improves across socioeconomic groups. And then the National Accounting Service 2021 ASER Annual Status of Education Report 24. तो जो नेशनल असेसमेंट है जो 21 और एसर दोनों शो कर रहे हैं कि जो एग्जाम फोकस्ड लर्निंग है वो हमें डेवलपमेंट नहीं दे रही, तो इसकी जगह पे डायग्नोस्टिक इनसाइट्स पे ध्यान दिया जाए, स्टूडेंट्स को क्यूरियस बनाया जाए, लर्निंग गैप्स को मीट किया जाए और फंक्शनली लिटरेट और न्यूमरेट बनाया जाए. तो यूज इनसाइट्स फॉर करिकुलम डिजाइन, टीचर ट्रेनिंग एंड टारगेटेड मीडिएशन. AI can play a very big role, but we have a separate chapter for AI. We will be discussing it there. Then the global best practices show national assessment of educational progress in US or of Australia, and there you get a school level diagnostic program, detailed analysis of school student response to get a better idea of how students should perform. ये international example दे सकते हो, international examples about how India can learn from different things. Progress in international student assessment, like competency based assessment at grade 10 is also important. PISA जो है वो है program for international student assessment, and PISA के exams valid होते हैं even for children taking admissions in foreign universities. India should adapt PISA so that we can measure our children's capacity compared to what the global children are doing. Similarly, there should be independent evaluation, third party assessment कीजिए ताकि ज़्यादा honest assessment मिल सके with respect to the knowledge and all that Human Development Authority in Dubai is doing. In India, we have the NIRF, which gives standardized ranking to higher education. Niti Aayog School Education Quality Index is there. But overall, we need to institutionalize third-party evaluation over multi-year engagement so that over the years, schools' improvement can be noticed. Benchmarking should be done at pilot basis in CBSE school and create continuous feedback loops for system-wide improvement. अब लर्निंग सर्वे से ये मिला है, पता चला है हमें, और मैंने आपको ये चार्ट दे दिया है, आप इसके तरफ ध्यान देंगे, that reading at least grade 2 level text at the percentage was 23% in 2014, and solving at least subtraction grade 2 level was 25%. During COVID, there was a lot of decline, and we see that those levels are slightly coming back, but COVID has resulted in actually going below even 2014 level. अब देखिए कोविड का इम्पैक्ट बहुत ही नेगेटिव रहा ऑन आवर लर्निंग आउटकम्स इन इंडिया. तो अभी हम डेवलप कर रहे हैं, बट इट विल टेक टाइम. अनदर इज व्हेन मदर्स आर बेटर एजुकेटेड, चिल्ड्रन आर बेटर एजुकेटेड, लर्निंग आउटकम्स आर बेटर. तो इसीलिए एडल्ट लिटरेसी प्रमोट कीजिए, विमेन एम्प्लॉयमेंट एंड गर्ल्स एजुकेशन को प्रमोट कीजिए, एंड सिंपल होम लर्निंग टूल्स बनाइए ताकि पेरेंट्स पढ़ा सकें अपने बच्चे को. और जैसा मैंने बताया, एज ऑफ स्कूल एंट्री इज वेरी इंपॉर्टेंट. साथ में प्रथम का टीचिंग एट द राइट लेवल इज वेरी इंपॉर्टेंट. तो ये सब आपको मैं बता चुका हूँ. Then digital access is important. 89% children have smartphone access, and over half use digital platforms for education, and about 75% for social media. So expand digital infrastructure, make it accessible to children. Digital literacy should become responsible, and use AI and technology to support teachers and students. Then we come to school to skilling. स्कूल एजुकेशन के साथ साथ स्किल एजुकेशन बहुत ज़रूरी है कि जब बच्चे स्कूल से ड्रॉप आउट करें, आज 2 करोड़ adolescents हैं पीरियोडिक लेबर फोर्स सर्वे 23-24 के हिसाब से, who are out of school. So how to bring them back to school? क्यों ये बच्चे बाहर गए? डोमेस्टिक चोर्स अटेंड करने के लिए, to attend domestic chores, the number goes to 28% who left school for domestic chores. ये generally women होती हैं. To support household income, ये boys होते हैं. So this is what is the major factor. 72% men and boys and girls are leaving school for 2 reasons. So address that. School को holistic बनाइए, educational training को skill development से connect करिए. कुछ गर्ल चाइल्ड के लिए मॉनिटरी प्रोविजन कर दीजिए स्कूल में, तो उस केस में यू विल हैव मोर एंड मोर अट्रैक्शन टू द स्कूल, एज आई टोल्ड यू ऑलरेडी. Then of course strengthening school education with skilling. So skill gap is huge. Formal training is there only in less than 1% school. Informal training in 7% school and no skilling in 91%. This needs to change क्योंकि हर बच्चे को आगे चलकर एकेडमिशियन नहीं बनना है, किसी को शू डिज़ाइनर बनना है, किसी को क्रिकेटर बनना है, किसी को चाइल्ड साइकोलॉजिस्ट बनना है, किसी को पेंटिंग करनी है. तो हर तरह के स्किल और आर्ट में डेवलपमेंट होना ज़रूरी है. और जो स्किल दिया भी गया है फॉर्मल ट्रेनिंग में, उसमें 52% इज ITES, which shows that most of it is in the IT sector, and other skills like textiles, office business work, electrical, electronics, healthcare is minuscule. So we need to improve formal skilling coverage. We need to improve a formal certification and training, and we need to make sure that all sectors have equivalent training. What is the policy imperative? Integrate vocational education into secondary schooling ताकि बच्चे अपने इंटरेस्ट के हिसाब से सब्जेक्ट चूज कर पाएं. Provide market aligned skills. जो मार्केट चाहता है वो सिखाइए, सिर्फ सिखाइए मत. Encourage continuation of education up to higher secondary level through various incentives. Institutionally establish composite school for a seamless transition from pre-primary to क्लास 12th. ऐसा नहीं कि 6th तक एक स्कूल में पढ़े, फिर 8th तक दूसरे में, फिर 10th तक तीसरे में. वहाँ बच्चे थोड़ा डिस्टर्ब हो जाते हैं. Curriculum wise, integrate vocational education from grade 6th to 12th with practical exposure and industry visits, and promote apprenticeships with industry linkages. So then we will have skill development and use future skills, AI, digital, and so on, so that people can learn how to promote themselves in future job creation. In higher education, we see that education institutions बहुत expand कर गए. So higher education institutions have increased from 51,000 to 70,000, और इसमें 52,000 colleges हैं अब, जो पहले 36,000 थे. We have 23 IITs, 21 IIMs, 20 AIMS. International IT campuses are now there in Zanzibar and Abu Dhabi. And we see that the enrollment in GER is, there are 4.46 crore people enrolled in higher education. Gross enrollment ratio is 29.5%, which is gradually showing an increasing trend. But imagine, it means 70% children of the age group which can go to higher education are still not going to higher education, not in the college, which shows a long-term challenge for India's labor force supply. Then of course, NEP-driven academic reforms have been brought in. National credit framework has been adopted, जिसके थ्रू आप academic और other skills को एक credit framework आपका एक certificate बन जाएगा और आप वो हर जगह recognizable होगा. Bank of credit बनाया गया है using 2660 HEIs, so that your credits get recorded and different institutions can simply present them. And then flexible entry, exit and biennial admissions have been introduced, so that if by chance I shift from one city to another and so on, I will be able to easily get admission. The target is to make gross enrollment ratio in higher education institutions to 50% by 2035. Then of course, the research and quality enhancement through Anusandhan National Research Foundation, multidisciplinary education, and regulatory reforms like Viksit Bharat Shiksha Adhishtan Bill for making sure that apex body is established with regulatory accreditation and standard setting tools, and the fragmented regulation can then be removed. तो regulation better करने का, research पे ध्यान देने की बात हो रही है. ये सब NEP के steps हैं जो आप mention कर सकते हैं अगर कोई question पूछें paper 2 GS में या paper 3 GS में, that what steps have been taken by government under new education policy to impact higher education. Then, of course, state and public universities are very important. There are 495 state public universities, accounting for 81% of enrollment in higher education institutions, and enrollment has been showing an increasing trend. And we see that Kerala with 43, West Bengal and Uttar Pradesh with 38 are the leading states in that. But it is important that they've developed better quality, better recruitment of teachers, better curriculum development, so that we can have much better results in state and state public universities. Gender wise, we see that 0.93 is the gender parity index, so 93% females per 100 males are there. And this has improved by 30% in the last 1 decade. It used to be 62%, now it is 93%. Sikkim has more than 1 female per male in the colleges. Goa has more than 1. Haryana has more than 1. So they are high performing states. And that shows rising female participation, especially in rural areas in higher education. And that is very good news, because if females are higher educated, then chances they will enter the workforce and improve female labor force participation becomes better. Also, greater autonomy and simplified procedures in Gujarat have given a good governance record. Capacity building in Maharashtra with State Faculty Development Academy, alumni engagement in Odisha. So these are industry linkages in IIT Madras. These are examples of how state level examples you can write. और इनमें से 3-4 याद कर लेना ताकि तुम कोट कर सको अपने आंसर में, अगर बात हो examples of how to improve educational development in India. And then NIRF is the institutional benchmark, so it is helping in understanding how qualitative indicators are functioning, and we see that southern India and Delhi has good quality higher educations, while northern and central India is quite struggling in that, especially eastern and central India. And then emerging representation from northeastern states and UTs. So we need to increase competition with EdTech platform, learner-centric performance linked funding should be there, and there should be greater emphasis on content quality and the legacy of the institution for long-term growth. Then, of course, industry academia integration is very important, especially in science, technology, engineering and maths, to make sure that there is proper creation, diffusion and application of knowledge. क्योंकि अगर आप STEM में एप्लीकेशन नहीं सिखाएंगे और सिर्फ थ्योरी सिखाएंगे तो उसकी वर्किंग कैपेसिटी स्टूडेंट की कमज़ोर रह जाएगी और रिसर्च कैपेसिटी कमज़ोर रह जाएगी. तो फाउंडेशनल स्किल्स होने चाहिए और इंडस्ट्री से लिंक्ड होने चाहिए. देन ऑफ कोर्स 75% ऑफ HEIs lack industry readiness. ये challenges हैं. Only 16.7% achieve 100% placement, or even 75% plus placement. Practical exposure is limited and faculty shortage is tremendous. What to do? So exporting industry academia collaboration is one important thing. Then co-development of curriculum. कैसे industry और academics के बीच में बढ़ाएंगे correlations? Co-development of curriculum. इंडस्ट्री कोर्सेज सेट करें, इंडस्ट्रियल टूल्स के साथ लैब्स बनाए जाएं और फैकल्टी को अपस्किल किया जाए. साथ में इंडस्ट्रियल जो वर्कर्स हैं उन्हें इंसेंटिवाइज किया जाए कि वो आकर कॉलेजेस में पढ़ाएं. सो इफ द पीपल इन इंडस्ट्री टीच इन द कॉलेज, प्रैक्टिकल एग्जाम्पल्स एंड प्रैक्टिकल वर्क विल बी शेयर्ड विद द स्टूडेंट्स. यहाँ मैं ये बता दूं कि इंडस्ट्री का मतलब सिर्फ फैक्ट्री नहीं है, इंडस्ट्री का मतलब रिसर्च इंस्टीट्यूशंस भी हैं. ऑल राइट. एंड प्रोफेसर ऑफ प्रैक्टिस का कंसेप्ट यूजीसी इसीलिए आई है कि इंडस्ट्री एक्सपर्ट्स इंटीग्रेट हो, बट ये बहुत फेमस नहीं हो पाया बिकॉज ये 3 साल के लिए ही अलाउ करता है और ये रिटायर्ड प्रोफेसर को अलाउ नहीं करता. सो प्रोफेसर ऑफ प्रैक्टिस हैज नॉट बिकम वेरी पॉपुलर इन इंडिया. We have iSTEM portal with shared R&D infrastructure platform with more than 50,000 researchers, etc. But then we have still not been able to improve the quality in Indian context. So what are the challenges in implementation? First, limited incentives for industry professionals, short tenure, strict eligibility, underutilization of teaching-oriented collaboration. So strengthen industry participation in curriculum, address faculty shortages through flexible hiring, and scale practical exposure. अगर ये 3 काम किए जाए, our employability, thinking possibility, इसमें मैं एक बात ऐड करता हूँ, make sure that question papers are unpredictable and teachers are rigorous. Then college education becomes better. Higher education has become internationalized, लेकिन इसमें ये देखा गया है that children going away from India is much more, coming into India is relatively lesser. So international students have increased from 22 lakh to 69 lakh in the last 20 years. But if you look at Indian children going away, it's much higher than what number of children who are coming into India. Also, China, USA, UK, Canada, Australia, France and Germany are attracting more international children. Even among BRICS nations, we are not attracting. China and Russia are doing it. In fact, in India, the largest source India's position is that it is the largest source of international students. 18 lakh children went away in 25, and 28 Indian students are going abroad per one inbound student. That is what I was telling you, that the ratio of outgoing Indian student to incoming foreign student is 28 is to 1, and that results in a lot of outward remittances, which creates a danger overall. So we need USD 3. We are giving an overall remittance of USD 3.4 billion only in our students leaving for foreign countries. The top destinations, of course, are Canada, USA, UK, and Australia. So this again, India needs to change. And again, I repeat, even among BRICS nations, India is at number 3 when it comes to attracting international students, which also needs to change. And this will change only with, now how do you change that? You change that with neighboring countries being attracted to India. Bangladesh has been a big support system for India, but we need to make sure that we improve upon that. That is equally important. So we are talking about inbound mobility is coming from Asian nations, but we are still struggling with respect to our capacity to grow and capacity. So Bangladesh and Sri Lanka and Bhutan, Nepal, they're sending students, but still, we are declining in our regional share as China and Russia are becoming more and more, popular. Now, in India, we are developing Study in India, leveraging NAAC, NIRF, IOE, NBA rankings. And Indian Technical and Economic Cooperation Program is training over 2 lakh individuals from 160 plus countries, but it is not good enough at the moment. We are struggling with our higher education, especially at international level. So we need to strategically reform, one, program diversification, short-term courses, semester exchange, and yoga, Ayurveda, etc. Education tourism has to be integrated. So bundle courses with tourism circuit for global South and BRICS student. Reciprocal mobility, have a exchange program, campus place movements, and so on, and improve better campus atmosphere. Then, of course, regulatory system has to be eased. Like we see a Gift City attracting foreign universities. Gurgaon has now a Southampton University, place. So the point I'm making is, it's only when we interact with global level teachers and global level universities, our own system will become better. Then, of course, alumni can be used, embassies can be used, and branding of Indian universities. But that branding happens only when we go up on the global ranking pattern, and that happens with quality of teachers, research and development happening in the universities, and the support system they can provide to the students. Then, of course, when it comes to health sector, we see that significant improvements are there in life expectancy, fertility, and mortality indicators. In fact, maternal mortality rate has declined by 86% since 1990, and much higher than global decline. Under 5 mortality has reduced by 78%, and neonatal mortality by 70%, all much above the global average. Infant mortality is now at 25, and several states like Kerala, Sikkim, and Goa are at 5 or 6 level, which is global developed economy level. So we see that neonatal care, immunization expansion, etc. are giving us good results here. Now we need to develop region-specific, imperatives to make sure that India does better. If you see Eastern India struggles on these indicators, we need to improve that. Then, of course, digital health transformation is seen. ICT intervention under Ayushman Bharat and Ayushman Bharat Digital Mission, eSanjeevani as the largest platform for telemedicine. Then enabled evidence-based policy making is there. AI-driven healthcare reforms are there at various places in India. And what is the progress seen? So in Ayushman Bharat, we see 1.82 lakh Ayushman Arogya Mandir, primary healthcare center की तरह function करते हैं ये, and 1.5 lakh with expanded services. 506 crore footfalls in Ayushman Arogya Mandir, 42 crore teleconsultations. Ayushman Bharat insurance program, PM Jan Arogya Yojana, has more than 42 crore cards, 11 crore hospital admissions, and 49% beneficiaries are female, 6 crore senior citizen. Again, ये figures याद रख लो, ये तुम quote कर पाओगे if you by chance get a particular question on Ayushman Bharat, or if you want to write an answer on healthcare development in India and achievements of the government program. Then, of course, National Tuberculosis Elimination Program, screening for non-communicable disease, hypertension, diabetes has become much higher. National Tuberculosis Elimination Program has reduced incidence by 21% and mortality by 25%. Treatment coverage has increased to 92%, much above global average. Then Universal Immunization Program, the UWIN portal we have established with more than 40 crore beneficiaries. Also, the enrollment of women, more than 72 lakh births have been registered here. Pradhan Mantri National Dialysis Mission is developing more than 30 lakh patients, and so Swasth Nari Sashakt Parivar Abhiyan with 1.5 crore women screened for anemia. इनमें से कोई भी 4-5 डेटा पॉइंट अपने पास रख लो टू कोट इन द जीएस एग्जाम पेपर 3, पेपर 2, गवर्नेंस में कर सकते हो, साथ में ऑप्शनल में कर सकते हो, इकोनॉमिक सर्विसेज में भी कर सकते हो. ये देखना है जरूर अपने पास. Then epidemiological transition we have seen. Unlike a classical linear model, India faces an overlapping transition with coexistence of communicable disease and non. ये तुम्हें याद होगा मैं क्लास में सिखाता था कि India has that unenviable situation where we have not been able to remove our communicable disease like dengue or tuberculosis or cholera, and we have already having large instances of non-communicable disease like hypertension, diabetes, etc. So we will have to focus on both. Our life expectancy has gone up to 70 years by 2023. Infectious disease has gone down, but we see double burden now. So the non-communicable disease are now 57% of deaths happening in India, and that persistent series such as tuberculosis, etc. are also continuing. Advanced states have much lesser communicable disease challenge, but much higher non-communicable disease challenge, and backward states are having both. So this is becoming a challenge. Cardiovascular disease, perinatal conditions, women have facing fatality at a higher level with cardiovascular are becoming a pattern in India. And that is why we have to focus balance between maternal and child health and elderly chronic care. Also, we have to focus on prevention and management of cardiovascular disease, diagnostic accuracy to be improved, and healthcare centers and lifestyle risks to be addressed. Now, obesity is again a challenge. Paradoxical, मैं पढ़ा रहा हूँ obesity के ऊपर, पर चलिए अब पढ़ा देता हूँ, मजबूरी है. But emerging challenges rising due to sedentary lifestyle, increasing consumption of ultra-processed foods, and then the non-communicable disease risk becomes higher. We have 24% women who are obese and 23% men who are obese in India according to National Family Health Survey 1921, and believe me, the numbers would have gone up by now than going down. 6.4% women and 4% men and 15 to 49 years are obese, which is less expected because at that time the metabolism is relatively higher. Among children also we see the numbers rising. So ultra processed food has to be controlled, dietary preferences have to change. The health and economic impact is felt heavily on obesity, disease, lack of work process, reporting on work. Now, government has intervened with Poshan Abhiyan, Fit India movement, Eat Right India, and so on, awareness generation. Health system response has been there for prevention and control of non-communicable disease. 31.5 crore adults screened. Ministry of Health and Family Welfare has introduced, but we need ultra fast, ultra processed food to go away from India. मैंने आपको ये बॉक्स पूरा दिया है, इसको पढ़ना जरूर. ये ultra processed food के ऊपर है, that what are the challenges we are facing on ultra processed food and how we can stop it. ये जरूर पढ़ लेना, ये आपके GS में बहुत काम आएगा. Then nutritional food intake पे आते हैं. पहला चैलेंज है चाइल्ड malnutrition, and दूसरा है micronutrient deficiency in women like anemia, like women having sufferance of calcium deficiency, iodine deficiency, and then adolescents के अंदर deficiency of vitamin D, anemia again being found. So lifestyle diseases like cancers, antibiotic resistance, that's another challenge that we see. So we need to make sure that calorie and protein intake grows, which is growing in India, but the pace has to be better. Rural-urban gap is narrowing, which is good thing. And consumption expenditure and calorie intake is showing a positive correlation. But we will have to make sure that food safety is now supplemented by nutrition safety, focusing on Anganwadi, Matru Vandana Yojana, and Poshan Shakti Nirman. Ayushman Arogya Mandirs are now giving service delivery to more than 1.8 lakh center, child and maternal nutrition, और आंगनवाड़ी सिस्टम के साथ मिलकर ये लोग काम कर रहे हैं. स्कूल में हेल्दी मील्स, फ्री फ्रूट्स, वाटर एक्सेस वगैरह पे काम किया जाए ताकि अल्ट्रा प्रोसेस्ड फूड पे ध्यान कम जाए, न्यूट्रिशन पे ज़्यादा ध्यान हो. स्पोर्ट शुड बिकम अ पार्ट ऑफ करिकुलम सो दैट फिजिकल एक्टिविटी इज लुक्ड अप बाय द स्टूडेंट्स. Wellness councils and written policies should be there, and community participation should be there to make sure obesity does not become the next epidemic in India. अब एक और चीज़ दिक्कत है इंडिया में, हेल्थ सप्लीमेंट्स का बड़ा मार्केट बन रहा है जो अनरेगुलेटेड है. उनका रिस्क बहुत बढ़ता जा रहा है और इसको अगेन इंफॉर्मेशन डोमेन में लाना ज़रूरी है. Also, in spite of all the efforts, we see that nutrition challenges persist. Poor diet diversity is there. We have excess cereal consumption. Fruits, vegetables, etc. are still lesser in number. Regional imbalances are there. So again, there is high fat in urban north, high calories in northeast. Then there is low adherence to recommended intake. Milk के ऊपर consume करना, eggs or protein source, etc. are much lesser. So, Economic Advisory Committee to the Prime Minister has said that dietary diversity is gradually rising in India, especially in bottom 20%, and better infrastructure and food choices are being seen. But if you ask me, still a long distance is there where we need to shift to nutrition. We need to have disaggregated data, region-wise specific, district-wise specific, because different places in India have different challenges. Carbohydrate consumption is much higher in India than protein consumption. And also a life cycle approach from infancy to adulthood support should be there. And micronutrient fortified food should be given, like rice fortified with iron, wheat fortified with iron, millets should be promoted, pulses should be promoted, eggs should be promoted. Nutrition programs should not focus on only amount of expenditure but on outcome that they can provide. And then the dietary guidelines related to diverse diets, higher intake of vegetables and legumes, reduced salt, fat and sugar, all that will create a possible improvement in healthcare. And of course, end of it is behavioral and awareness strategy that use social media, use targeting people directly, use schools, hospitals, district headquarters to generate as much information as possible. Then we have a Rajasthan cash plus model where the child nutrition was 31%, underweight 27%, wasting 16%, and pandemic disrupted the schemes like Prime Minister's Matru Vandana Yojana. तो cash plus model में क्या किया गया? Cash transfer scheme को एक साथ इकट्ठा कर दिया गया with social and behavioral change कि लोगों को incentive देने लगे कि अगर आप बिहेवियरल चेंज दिखाएंगे तो आपको कैश ट्रांसफर मिलेगा। और 5 ट्राइबल डिस्ट्रिक्ट्स में ये किया गया है और इसमें पाया गया है कि हाउस होल्ड्स में मदर्स, हस्बैंड्स, मदर इन लॉ, कम्युनिटी, इन सब को टारगेट किया जाए, आंगनवाड़ी वर्कर्स को इन्वॉल्व किया जाए, ऑक्सिलरी नर्स, मिडवाइफ्स को, accredited सोशल हेल्थ एक्टिविस्ट वर्कर्स को। नतीजा क्या आया? दैट विद दिस मल्टी चैनल communication, community events like Godh Bharai, Annaprashan, print, radio, media, digital outreach. So the outcome is, natija kya aaya? Women using cash for nutrition increased. Food use rose for 30% to 89%. पहले जो कैश लेकर लोग इधर उधर खर्च कर देते थे वो अब खाने पे खर्च करने लगे। 35% more women gained over 6 kg during pregnancy. 49% increase in use of local food. तो इससे क्या हुआ? जब हमने एफर्ट्स किए हैं, ये राजस्थान का प्रोग्राम बताता है, वहाँ रिजल्ट मिला। अब इसे एग्जाम्पल लिख सकते हो एज अ केस स्टडी वेयर focused government program merging different initiatives has resulted in better use of cash given compared to what used to happen earlier. तो फाइनेंशियल ट्रांसफर से सिर्फ बात नहीं बनेगी, इंफॉर्मेशन कैंपेन इज इक्वली इंपॉर्टेंट एंड इन्वॉल्विंग पीपल इज इंपॉर्टेंट फॉर बिहेवियरल चेंज। एक इकोनॉमिक सर्वे काफी बात करते हैं ऑन डिजिटल एडिक्शन, ये भी खूब अच्छे से पढ़ लेना, इस पर मुझे उम्मीद है इस साल एक क्वेश्चन आना चाहिए ऑन डिजिटल एडिक्शन। तो इसका एक तो डिजिटल एक्सपेंशन बहुत हुआ इंडिया में। द डिजिटल इकोनॉमी हैज नाउ रीच 11.74% ऑफ जीडीपी, प्रोजेक्टेड एट 14% अराउंड बाय 25। Internet users have grown from 25 crore to 97 crore and 85.5% households own smartphones. The usage is 48% video, 43% social media, etc. 40 crore users are there for OTT. But the challenge is that gradually people are getting addicted, that is compulsive, excessive use of digital devices causing psychological distress and functional impairment. What is the cost? Reduced academic performance and productivity, financial losses from online spending and weakening of social capital, क्योंकि लोगों को बात करने की आदत नहीं रह गई, लोगों से मिलने जुलने की आदत नहीं रह गई, सारा समाज ऑनलाइन बनता गया, तो लोग की cognitive abilities to interact, to solve problems together, community life has taken a toll. Social media has linked itself to anxiety, depression, gaming with sleep disruption, online gambling with financial stress, anxiety, and streaming short videos with poor sleep, low concentration. ये अगेन अच्छे से सब याद कर लेना, लिख के रख लो, because this will be a question or even in an essay possible in UPSC. Youth is more vulnerable, of course, the 15 to 24 age group, and that has resulted in social connectedness being compromised, mental physical well-being compromised है, and impacts both hedonic well-being, happiness को कम करता है, and purpose fulfillment, eudaimonic well-being, which is purpose and fulfillment in life, उसको भी affect करता है। तो अब ये देखा गया है फेसबुक सोशल कनेक्टेडनेस इंडेक्स में कि इंडिया में जो कंपैरेटिवली बैकवर्ड डिस्ट्रिक्ट्स हैं वहाँ पे सोशल कनेक्टेडनेस ज़्यादा है और वहाँ सुसाइड रेट्स कम है। जहाँ पर भी लोग सोशली बेटर कनेक्टेड हैं वहाँ सुसाइड रेट कम है, और जहाँ लोग ज़्यादा सोशल मीडिया पे हैं वहाँ सुसाइड रेट ज़्यादा है। तो इसलिए बैकवर्ड डिस्ट्रिक्ट्स लाइक बिहार, उत्तर प्रदेश, the connectivity is relatively better with better social ties and limited cross district connections. In Kerala, Tamil Nadu, it is exactly opposite. So global responses, WHO has said gaming disorder is being found as ICD-11. Australia has banned media accounts for children under 16. China has strict gaming limits. South Korea has a shutdown law. Singapore has a media literacy council promoting cyber wellness. United Kingdom has digital resilience framework. School level restrictions and export systems. So we have multiple countries doing multiple things. In India, the response is CBSE has created safe internet use guidelines, Pragyata framework, Ministry of Education for digital education planning, but still in India we have a much lesser impact compared to what it is elsewhere. Telemanas is for mental health use for people using digital things, and 32 calls have been handled on that. The Shut Clinic is with respect to Nimhans Bengaluru of for again health and awareness regarding mental health disposition for digital gaming. So overall, and government has brought the Online Gaming Act 2025 preventing money-based online gaming portals, but still a long distance has to be traveled here. Many in India don't even realize mental disorder, forget mental disorder due to digital challenge. So what is the way forward? Strength the evidence base, ज़्यादा data collect कीजिए, policy design देखिए उससे, multidimensional monitoring indicators दिखाइए, usage pattern, sleep quality, anxiety, stress, productivity that is affected, safety of the individuals, इन पर ध्यान दीजिए ताकि कम्युनिटी अवेयरनेस डेवलप की जा सके, एडल्ट्स को बताया जा सके ताकि बच्चों को राइट गाइडेंस मिल सके. Of course, offline alternatives बढ़ाइए for hubs for youth, playing activities in outdoor arena, safety for women outside, and so on. More and more interaction there. Family and parental role, school and community centers to be developed. So it's not like going to the old world, but it's more about interactions based on human interaction than only digital interaction. Of course, at technology level, we can have safeguards like simpler devices can be used, educate only tablets can be developed, ISP level protocols can be developed, differentiated data plan. जैसे हम लोग pornographical site बैन कर देते हैं, हम 12 बजे रात के बाद या 10 बजे रात के बाद ऐसा कर सकते हैं कि चाइल्ड के नाम पे जो फ़ोन है उनके ऊपर डिजिटल ट्रांसमिशन बैन कर सके या रोक सके. Of course, the outlook is the risks are there. There's double burden of disease that India has. Data-driven governance is being used in India. Tech-enabled frontline systems are there, and behavioral interventions have to be improved. However, if we integrate overall human development with digital awareness, we can do far better. Thank you, all of you. I will be coming up with the next video very soon. Thank you. God bless you. Keep studying well. Bye-bye.